Hi, I'm Dr. Sunil Kumar K, a lead consultant interventional pulmonologist at Aster CMI Hospital, Bangalore. Now, the climatic changes and the impact onto the lungs. Definitely, the seasonal changes are definitely going to be a risk factor for something with the lungs, which as an atmospheric exposure, roughly in a day, we take a 10,000 liters of air in and out. Definitely, the quality of air matters, and the humidification factor also matters in terms of how healthy we can maintain. Unfortunately, with the seasonal changes, we have this crop of viral infections, which is most common, and it's not an exception to the rule that last 4-5 years we have seen that COVID, which has surged in the winter season, hoping that in the summer we can get some sort of a breather. But unfortunately, that was not a case. But invariably, the winter season are a more vulnerable thing because of the humidification factor, closed network, closed space where cross ventilation will not be taken care, and extremes of ages are more vulnerable. At the same time, the climatic changes invariably the protective mechanisms like the dust and the pollutions, which adds on to this particular climatic changes to be more vulnerable to catch up this prolonged nagging symptoms, which might prolong. As being already been dealt with, airborne infections are most commonly transmitted in this winter season. Somebody has to be very careful in terms of cough etiquette has to be followed, proper distancing has to be maintained, and a proper hygiene in terms of somebody has cold cough, try to take off from your usual routine so that you can wear a mask so that you can not transmit to others. These are the basic fundamental things which has to be followed to avoid any further worsening of vulnerable population like extremes of age with multiple comorbid conditions like diabetes or any sort of a malignancy on any chemotherapeutic medication. These are the subset of patients who are vulnerable to prolonged infection. For them, a hospital stay also can be a huge burden in terms of getting out of all this crisis. So the bottom line message, take up precautions in terms of wearing a mask could be the reasonable if you have a cold cough. Have a good distance maintained so that airborne infections can be curtailed, and a good hygienic nutrition thing has to be followed. So to conclude, actually, to avoid vaccination is a good policy. Any vulnerable population will always better to vaccinate against the influenza, and at the same time following a good cough etiquette and avoid exposure to dusted place and polluted space as much as possible. Keep yourself warm, and when you're indoors, take all these precautions to help you away from these infections.